We are doing the low-dye taping technique at the foot. This is indicated for orthotics. This taping technique will be used as a trial period to prove to an insurance company that permanent orthotics would be effective for this particular patient. So a couple clinical predictor rules include 2 degrees or more of forefoot valgus, 78 degrees or less of great toe extension, and a 3 millimeter or less navicular drop. So my patient is lying prone on the table, and for this taping technique, you're going to have a half roll of tape with just like little skinny tiny strips, and then you're going to have the big guy of tape. So the first tape that we're going to use is one of these skinny strips. So you're going to apply it onto the first met head, and then we're going to go around the calcaneus, and you want to be mindful of the Achilles so she doesn't get any cuts from the tape in the back, because that wouldn't be the most fun you'd ever have. And so once you have the first piece of tape on the first met head, you're going to move to the second met head and do the same thing. Come around the calcaneus and back to the second met head. And you're going to continue this technique going all the way to the fifth. Sorry about that. We're going to go all the way to the fifth, but just for the sake of this video and for saving tape, we're not interested. So then you're going to put a piece of anchor tape to cover the back of your tape job. It's just kind of hanging out in there, sorry. So then after you have that on, after you relax down, I'm going to do a few more pieces here. 1, 2. We're going to close off the bottom here to cover up our tape job so it doesn't fall apart. 1. And there's 2. So the bottom will be closed off. And like I said, you would be using more tape than this, but for the sake of this video, we're not. And so then I'm going to have my patient flip over onto her back. And we're going to do the same thing that we were doing on the bottom of the foot, except we're going to close off the top of the tape job to hold it all in place. So then this would help kind of create an arch support, and this would again be used to help prove to insurance companies that orthotics would be useful for this patient.